in an effort to let you know where some of the money goes from our foundation, the results of the duck dash, you know, we periodically update that a little bit, but I have one of the people who is with Union Gospel Mission, which is one of the recipients of a substantial amount from us for some things that they need to keep going and be successful. And I'm going to introduce Skip Steffen, who is in charge of Union Gospel Mission. I'll tell you a little bit about it, and he'll come up and tell us what they're doing. Skip's, he's an undergraduate and graduated in education, his education was in chemistry and biochemistry. 1970, he moved to Olympia to supervise a chemistry lab at St. Peter Hospital. He counts himself blessed to have only had one employer for over 30 years, which is the Sisters of Providence, St. Peter Hospital. Over his 30-year career, he became laboratory director, was involved in sleep/EEG services and dialysis services. In the late 1990s, his interest shifted towards the business side of healthcare, and he ended his career with St. Peter Hospital on a 4-member team that developed the business plan for the first floor expansion of the hospital. Then he retired in the year 2000. In the mid-1990s, he had realized just how blessed his life in Olympia had been and wanted to give back. So he joined with George Wenis, who some of you remember as a member of our club, the founder of the Olympia Union Gospel Mission, in 1995 becoming a board treasurer. In 2005, Skip failed retirement and became the executive director of the mission when George stepped down. Mission has been a labor of love now for over 20 years. So let's welcome Skip Steffen.
See how well I can do with my left hand here. So, thank you very much. Your club donated to the mission $1,000, and the donation was intended to purchase chairs for a new expansion in the day center. And due to circumstances beyond our control, I have yet to spend the money, so I'm going to tell you how it will be spent rather than how it was spent. We applied for the building permits in April of last year. We received the building permit in September. And so you can imagine what that did to the time frame for the project. And so it's kind of a note to me in the future, never try and do something at the leading edge of it or at the middle of a construction boom, because the city was just deluged with building permits. And so it was kind of interesting. So I got 3 slides about the mission, and then I'll kind of launch into a discussion of why we're doing what we're doing. So as mentioned, the mission was founded in 1995, and our mission is that we are a evangelical Christian rescue mission serving the greater Olympia area to share the good news of life in Jesus Christ by meeting the physical, mental, and spiritual needs of individuals in crisis. Our vision is that as God directs and provides to meet or exceed the community's needs for basic services, and I'll define those, emergency dental and vision care, and transformation of lives through Christian-based drug and alcohol recovery for low-income and homeless people. So someone asked me about our funding. So one way to look at us is we're a church that provides services. And so through that, we have to be totally independently funded. We cannot take any governmental community money. And that's okay. I mean, that's a decision that we've made to be that way. And so all of our funding, about 80% of our funding comes from donations from individuals. And just to give you a clue, our annual budget's about $1.1 million. So that gives you a sense of the support that we receive out of this community from individuals. The other money, some of it is income from events we put on, rental income, and some foundation grants. For a project like this, I'm going to talk to you about a $500,000 project, and about $200,000 of it has been funded through private foundations, and so the other part was raised through people in this community who believe in what we're doing and are contributing to it. I would say that we're focusing on individuals who are chronically either homeless or have chronically been in difficult situations economically. We're not a drop-in shelter. If somebody comes to us and they've lost their job and they're on the street because of poor financial decisions, we're going to try and get them to another organization. Our target population is really people who have been homeless for a significant period of time, and I'll talk to you a little bit about most of them. And we provide on their basic services. We've got a day drop-in center that you'll see in a moment. And we're serving hot meals, we're providing showers, laundry, clothing bank, chapel and church services. And about 80% of those folks are homeless or couch surfing or living in cars or whatever, but those living arrangements categorize you as homeless according to the federal government. And about 20% or so are low-income individuals trying to stretch their budgets through coming to us, the Salvation Army, the food bank, for meals and other services that they can save their money then to pay utilities or rent or something like that. Health services, it kind of flips. About 75% of the people who come to us for dental care now and vision care are actually not homeless. They're the so-called low-income working poor or people on disabilities. And then in terms of our goal-oriented shelter and drug and alcohol recovery, about 60% of the folks we encounter there are homeless. And the remainder are in some sort of semi-permanent living conditions and get referred to us for rehabilitation. And these are long-term commitments. We work with people for 3 years or more who come to us because they really, their lives have gone way off the rail. And it's not uncommon. You probably heard seminars about ACEs, adverse childhood experiences, or heard that discussed in the community. And in the rescue mission business, we've known about that for decades because most of the people we deal with left home by the time they were 10, 12, 13 years old. They were smoking, they were drinking, they were doing pot and other things long before that. And a great deal of that was really to cover over the pain of very acute abuse in their home life. And so when we encounter them, they may have been on the streets for 20 years, for example, never graduated from high school. And so you can imagine that it takes a long time to work with somebody to rehabilitate a life that's been lived like that. So we're a long-term process, not a short encounter with the mission. And our 5-year, when people graduate from our program and we follow them, our 5-year success rate is 77% for the people we work with. But it represents the length of time of the commitment, as well as their desire to change. They really have to want it. So this is the front end of the day center where we offer the meals, the showers, the laundry, etc. And on the other side of the building is healthcare services. And so there was the building has shared those two services now for some time. And you can kind of see, if I can get this, over here is that door that I showed you. And this is actually the dining facility now. There's a hallway that runs through here past two bathrooms. And then our to the left over there is the shower and laundry. And then, sorry, I'm getting through this. And then over to the bottom side of the screen, there's actually another dining space. You know, no one in their right mind would design it that way, but the building was just slowly evolved over time into the service of these functions. And inside the red markers is where our healthcare services are provided. And in the upper right-hand corner, you can kind of see the outline of the dental chairs. Over across the hall from that is our vision clinic. And then there's 3 medical exam rooms and a lot of infrastructure for healthcare. Before the Federal Care Act went into service, we had about 600 people who considered the mission their primary care medical home for chronic diseases, diabetes, hypertension, heart failure. But as soon as the Affordable Care Act was implemented, these folks now had access to health care insurance, and within a few months, we were able to migrate them out into the private health care community. But that left a lot of space that was now underutilized in that building. And during that time, this is what was happening to the meals we were serving. And just a tremendous, 10 to 12% a year growth or more over that period of time. Especially it took off in about, 2011. Part of it, I think, was economic. Some of the later growth, quite frankly, was due to the legalization of marijuana. That brought a lot of people into the community. And then the continued breakdown in the social and home fabric for people, especially in the low-income areas. And even to now, even with this improvement in the economic conditions in this community, it's estimated that 20%, 1 in 5 people, is food insecure. And so these kind of graphs, I think you would see from the Salvation Army, you'd see it from the food bank. It's just a kind of a representation of the general economic condition in the lower income ranks in our community. So what to do? A few years ago, we purchased this building on Washington Street, 309 Washington Street, and notice the left-hand side of where the iron gate is over there. This is kind of a hard graph to follow, but people will come down the side of the building and enter into the waiting area, a reception desk. Just to the left of there is where the vision screening and the vision exam rooms are going to be. And behind that then is the two, to the far left wall, you'll see the 2 acute chair, dental chair operatories. In the upper left-hand corner is a dental hygiene room. And then just outside that is a station for the panoramic x-ray machine. It's shown as a pan. All of our imaging in dental is digital, and we use that panoramic x-ray machine a lot because last year we did 1,800 visits, and most of these patients are unknown to us. And so we do we use panoramic x-ray a lot to gain a picture of their whole entire mouth, just not just the tooth that's bothering them at the moment. And then in the lower left hand is decontamination and office space. So once the goal here is that, and I think Dustin's folks are flying around spraying paint everywhere in the last couple of days, and so we're getting close to having this ready to put the tile in and then start installing the dental equipment. And the Murdoch Charitable Foundation out of Vancouver got interested in this, and based on the community support, they've committed up to $100,000 to help us upgrade the dental clinic and also do some work back in the other side of the campus. So it just shows you how it's kind of a synergistic thing. We have to have the support of this community, but other people recognize it and they're willing to help us with this. So when this is done, we will then be able to move all of the healthcare facilities out of the other building, and we will be able to take all that space that you saw was devoted to healthcare, and that will then be turned into dining space. So we'll go from a very non-functional space, able to serve about 60 people at a max, to a space that will seat about 140 people. And your $1,000 is going to go towards helping us purchase some of these chairs that are going to be at these tables. And right now, it varies a little bit, but that 102, 3, 4,000 meals a year, we're serving on a Monday through Friday. We'll serve close to 500 meals a day. So at 60 people a sitting, you can see if we're serving 150 or more meals for a lunch, we have to turn that room right now at least 3 times, sometimes more. And so it's very dysfunctional. People are crammed in there. We need to do better for the people that come to us. And so once we're done with this, there will be a dining space that really kind of preserves their dignity and tells them that we care about them. We're also doubling the number of showers from 2 to 4. We're doubling the number of washer dryers from 2 to 4. And in preparation for that, in the back lower left, we've expanded. We now have 4, two walk-in freezers, 2 walk-in refrigerators. Everything's just about doubling. And we've beefed up the kitchen equipment to handle this as well. The Boeing Employees Community Fund was very helpful in purchasing the kitchen equipment. And so this is where, your $1,000 will ultimately wind up about March of next year in helping us provision and equip this room. Any questions to there about, yes, sir?
We had a presentation from Catholic Community Services, and they are serving about 380 meals a day, 3 times a day, and they're serving 500. That's a tremendous amount of hungry people in our community.
Yeah, between Salvation and us, I would estimate that there's over 250,000 meals being served in the community, about 300,000 a year. And then you've got First Christian Church. We don't serve on Sunday afternoon because, not First Christian Church, but First Baptist Church serves several hundred meals on Sunday afternoons. And then, you've got all the special feedings like Barb's Family and Friends. They're not serving just the homeless, but so I'm going to say there's probably close to 400,000 meals served in this community annually if you look at it overall. Yeah, it's a tremendous amount of effort. Yes, sir.
How is your working relationship with the other services like Salvation Army and the others? Do you all work together and help each other out, or are you fighting each other?
No, I don't feel that there's any, there's enough need to go around. And for example, like our shelter, for example, we're sheltering people who really are committed to making a change. They're in on a 30-day contract that's renewable. They're accountable for a whole lot of things. First Christian Church is sheltering people. Interfaith Works and First Christian Church is really sheltering people who they're vulnerable, they need off the street. Very different goals. Salvation Army has a shelter system that not only serves that population, but they're also working with people and programming there. And so we're all kind of doing the same thing. We share resources. Salvation Army recently had a windfall in terms of being able to get some meat. They didn't need it all. They turfed it to us, vice versa. We do produce. So I don't sense any real competition between us and them and the food bank and Catholic Community Services, which runs their kitchen. It's really kind of collaborative because we all know that if we got to work together, or else we'll kind of fail together at the same time. So I'll tell you what, I've got, it's 10 after noon. How much longer do I have?
About 5 minutes at what?
About 5 minutes. I'll tell you about one other program that we've started that I'm really kind of excited about. This is just some shots of, this is the women's facility. The upper left is the short-term shelter for women, and then the bottom is where women and their children can come. This is a house over near South Puget Sound Community College that we have. It's a 6-bedroom house, and this is where our men who are in the long-term drug and alcohol recovery program reside. And then this is one that we started last summer. And I just kind of walked through the mission one day and I said, I wonder what happens to kids who can't get to the schools for the free lunches during the summer. Where do they go for food? And I've got a staff that just, boom, that was an idea, and they were off on it. And especially a lady by the name of Mindy Owens, who does our community relations, and she came back to me and said, well, you know what, they've got enough junk food. They've got mac and cheese, they've got a lot of things. What they don't have is produce. And if you stop and think about where your grocery money budget goes, protein and produce are probably the 2 biggest expenses on the menu, if you will. And so it was just kind of amazing how God brought all this together, because even the Shelton Food Bank started contributing produce to us. And so we have produce now, and it's just kind of coming out of everywhere. And so we thought we'd just run it during the summer, and we were delivering produce once a week. And as strange, just to show you this, we're delivering to 8 sites, 8 pockets of poverty in Olympia, Lacey, and Tumwater. We could probably do twice as many with if we had the volunteers. And there are kids out there that have never eaten a strawberry. I'm serious. There are kids out there, you hand them a cantaloupe, they don't know what to do with it. They've never seen it. And as we got into this, then we began to realize that us providing this produce was helping mom, especially in the single family case, with a little extra money. She had money that she wasn't spending on produce that she could use maybe to replace the light bulb in the bathroom, as one kid said. It's just, your heart just goes, But this is something that I think is really, there's a lot more that can be done. This is a ministry that now we're running every other week during the winter time. And it's just amazing how you kind of start out with something pretty simple And, you know, no, this is not high-tech science or anything else. It's just, I wonder what the kids eat during the summer. And there's just these pockets of need in this community that we just don't see in my life. Or I had no idea what went on downtown until I retired from St. Peter Hospital, lived down at Cooper Point, drove back and forth. You know, it's pretty amazing. So I just want to sensitize you to that, and then I'm done.
We can take some more questions here, right? More questions? Renee?
Yes.
Low barrier, are you low barrier service?
I would say no. I would say we're more medium to high in terms of, we have expectations of the folks who want to come in. You can come into our shelter in, you know, high, but we have an expectation that you're not going to be using when we're working with you. And obviously in our drug and alcohol programs, we expect abstinence. Yeah. Yes?
Other than your women's shelter, for your day use, is that men only, or is it both genders?
No, we have both genders, and I didn't emphasize this, but one of the areas that we're putting into this new design is a family dining space off to the side. Because when the family, we used to have a lot of women, what we call them, a lot of women with kids who would come, they'd be in shelter overnight, and they have to leave at 7 in the morning, and they can't get in until 7. They come down to the Mission. And when the Family Support Center opened, that population virtually disappeared, and we were pretty excited about that. But now the Family Support Center is full up, and we're starting to see women with their children come in. So we've created, in that new design, kind of a dining space for them. Yes, ma'am?
Yeah, do you receive produce from the Olympia Farmers Market after they close on Sundays?
You know, Phil Pareto with City Gates Ministry is picking that up, and he has a relationship with the Boardwalk Apartments and other places. And so, by and large, he has an established clientele, and so the answer is no, but it's not that it isn't being utilized.
Are you interested in it?
I'd be interested in talking about it for sure. Yes. Yes, sir.
You talked about how many meals are served. If you added into that all of the high schools and junior highs that have free or reduced breakfasts or lunches or summer programs, I think it would really go double that.
I'm sure it would. What are they saying now? There are about 1,700 kids in Thurston County that are listed as homeless in the school district. We serve some of them. We see some of them come into the dental clinic. But, you know, there's all kinds of need that out there that's being served that we're not, you know, we're just tangential to. Yeah, you're right. And then you look at the summer feeding programs in the schools. Yeah, many thousands.
We have one question. If I understood you correctly, you said that you have a 70-some percent, 77% success rate. That's about a 5-year window.
Mm-hmm.
What does success look like? Is it I graduated from high school, I have a job, I'm able to live on my own?
For us, success means you're able to live independently, which assumes a job or some other stream of income. You're able to live drug and alcohol free, and you're connected to a body of believers. That's success for us.
Good. Round of applause for Skip, please. Don't wait.
We're really pleased to be able to give you the $1,000 that'll go towards the program. We serve a lot of agencies, work with a lot. One of them is the South Sound Reading Foundation. And we want to gift to them on your behalf, if you'd sign this, a book for one of the children. I have to try to pick a book that matches the topic, and sometimes I fail miserably. I'm a long-term project too, because we get the books from the South Sound Reading Foundation that they like. This one's called Pigaroons. And it sounded interesting, looks interesting, so if you wouldn't mind signing that in your name, it would be great, and we'll gift that again to the South Sound Reading Foundation.
Thank you.
Okay, thank you, Skip, very much. Appreciate it. Good work. We appreciate the great work that Union Gospel Mission